Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, what are you going to talk about today?
Well, we have a giveaway.
Oh, yeah.
Yeah, these are not sunglasses, Bob. I can guarantee you that.
Right.
But they do massage your eyes and your temples. They heat up. They have
play a little music.
a little relaxing music. And actually, we really like
Really
them.
good for dry eyes, but also, I think, stress.
Yeah.
You know,
Yeah.
it's stressful being here with you, Brad. And
Yeah.
This I should really put it on.
Yeah, you could do the whole video with that on and see if you can get through better with me. I don't know. My wife has to wear them 24/7 when I'm around.
You look a lot better when you wear them, too.
Well, I should paint some eyes on there. Anyways, let's go on the hip, Bob.
All right.
So the hip, we want to learn how to stretch it, and people want to know how to stretch it, but we have so many good stretches where you're laying on the ground.
Right.
That I like to do.
Lying on the ground.
I like to do them with the stretch, but you do have to lie down, and people don't want to do that.
Right.
Sometimes. It's
they
not
want to be able
easy.
to do a seated position
Yep.
or a standing position.
Right.
So,
Either they can't get down on the ground because of their age or whatever, or
Right.
you want to be able to do that at work.
even convenience.
Yeah, in the
Right.
convenience store even. So here we go. The first one we're going to do, we'll show some in seated, and then we're going to show some in standing.
Sure.
And then at the end, we're
we
going to show
have
some.
a real treat for you.
Yeah, actually, it's a hip decompression.
Right.
That's easy to do, and we'll show
You're
that.
going to want to stick around for that one. It's really cool.
Yes. And it won't take too long to get through these, so that'll be all right.
No, we won't keep you hanging on.
All right, seated position. Simple one, knee to chest. And it's just here you can grab underneath.
Yeah, if you have trouble getting the leg up, if you can't reach the knee,
Yep,
you can take a belt or a rolled sheet,
Yep.
and go up like this.
yep. And so pull whatever it takes. Sometimes you can go around the knee. That actually ranges out your knee
Right.
a little bit. So it's kind of a double win situation. And just do that 5 to 10 times. Or if you want to hold it, I like to actually, when I do this, I always go this, and then I pull over across towards my opposite shoulder. Gets a little more hip muscles in there, that piriformis.
Just a piriformis ball,
Yep,
yeah.
exactly. Make sure you do both legs. The next one, now this one is a really nice one. Everyone should do this,
Yep.
I think. It's the seated figure 4.
My favorite hip stretch.
Can I?
Yep.
Can I use the belt this
Yep,
time?
yep.
So some people have a difficulty doing this, particularly when you get
I got
older.
a neighbor that I was showing this to, and he could get his ankle onto his opposite knee.
Right. It's very common as we age and get tighter. So what you do is you take your belt like this and put it around. There we go. And I'm going to pull up like this. You know, if you've had a hip replacement, you're not going to want to do this video.
You're not doing any of these.
Right. There's a few you could do, but we're not. We're addressing people with normal, original hips.
Right.
The original equipment hip.
Yeah,
So
exactly.
you go up like this, and eventually, you'll be able to do that. And this, you're probably not going to hold this stretch just because your arms will get tired.
Right.
So you just stretch.
Pressure on, pressure off.
Yep. 5 to 10
And
times.
the same when you get up there and get the ankle onto the opposite knee. Do some pressure on,
Good point,
pressure
Bob.
off, pressure on, pressure off.
And
This
if
one
you,
feels good.
Yeah, if you don't have any hip problems, you just want to maintain this range of motion
Yes.
as you age. Do it. This every time I put my shoes on, I sock shoes and I'll do a couple stretches, and it feels good actually
Right.
too. It's fun.
Well,
So,
You
well,
have- you have a really fun life, Brad.
yeah, I don't get out much. Where are we, Bob?
Internal rotation.
So then we also want to do this motion
right.
with the
It
femur.
goes this way. It also needs to go this way.
Right. So this one is kind of hard to do. Even myself, when I do this
Right.
one, either grab my pant leg or again, get the old belt out and then you just gently pull over.
Right.
And this is usually limited compared to this direction for most people. So you just do what you can.
Well,
You
it's
can
definitely
bring
on you.
Yeah.
That's the case. Brad tends to turn his hips out.
Yeah, my hips are externally rotated.
Yep.
That's just my genetics.
Yep.
Yeah. So
Next one is extension. A little bit difficult to do in a chair,
yes,
but I'm going to show you. You can actually move your butt to the end of the chair
yep,
and then move your hip back like this.
yep.
And you can kind of lean onto the leg that's in front and you're stretching that hip right there.
This is one I would definitely do like next to a table
Yeah,
so you can stir
right. So you don't
yourself.
fall off the
Yeah.
chair.
If you don't feel comfortable doing this, yeah, we don't want you to fall off.
Right.
We're going to show you better options standing that's easier to do with a wall. So
Well, in the staircase, right? Also. Oh,
yeah, you could do it there
yeah.
too. Yep, exactly.
All right.
All right.
Where we at, Brad?
Well, we're going to go to the standing exercise. We might as well address that hip
Sure.
extension.
Sure.
So if you just want to go up to the wall, this is the one I'm going to stretch.
Oh, sure.
I'm going to go like this.
Yeah,
And,
that probably is the easiest way.
yeah. And you got the wall to steady yourself.
Yep, as support.
Yeah. And you also get your calf muscle at the same time, which is kind of nice because
Got a
that
little
muscle.
bonus.
Yep. Do that and just on and off 5 or 10 times. Okay. So the next one, flexion, standing. If you're pretty mobile,
Right.
this is what I do. I have a stool, or outside I have a big concrete step to hold the landscaping, and I'll put my foot up on there and I'll just lean in and stretch. Again, we're getting the knee, ankle, and the hip. So it's a triple joint stretch, which is kind of nice. Get it all done at once. And then for my hip, I will add this. I'll go in. Again, these are not creating pain. It just feels like a good stretch. And I put my hand here and I put my elbow, or you can push here, but get that knee to go out, and that abducts the hip along with the flexion. Oh, that's a good one.
Now, a lot of you are not going to be able to put your foot up on a chair or stool like that.
Exactly.
And that's why a staircase works really well.
Right.
I've had many patients do this in the stairwell.
Yeah.
And
hold on to
Yep.
the handrails, maybe one if you got
I
two.
had 90-year-old women do this.
Sure.
I mean,
What about 90-year-old men?
yeah, they're gone.
Yeah,
Yeah.
usually the men aren't existing anymore.
Yeah.
But anyways, when you stretch like that into, and
Right.
you might
And the
start out
rails
with
can
this
give you a
step.
little pull. Yep.
Yep. And then as you get more, you just go up to the next step. That's kind of nice.
And it showed me how tight people were that, yeah, they would do just even a minor version of that. And
Yep.
it hurt.
Yes.
I mean,
Then
so,
the other thing you can do in that is after you get done with your flexion, you can hold on to one rail and then just give your hip, your knee a little push outwards
sure.
and
Push
inwards.
inward.
Yep. And that'll affect that hip and give it more range of motion. Stretch.
You'd be ready to shake your hips like Elvis.
Oh, Bob. That used to be almost illegal at one point.
Yeah, it was.
That was
He
a
was asking
big
them not
deal
to
back
do it
then.
on
Yeah.
TV.
Were you alive then?
Oh, well, I wasn't. I didn't see it live. No, I was
Well, nobody
in the
cares.
60s,
anyways.
right? Yeah.
I don't know. All right. So
All right.
now let's go. This is the big now
The
this
big
is
surprise.
the big surprise. We've done this before actually, but
Right.
a good friend of mine actually fell on I think it was the ice. I don't know. He fell on his hip about a year ago. He's
Sure.
having this back pain, hip pain, didn't know what it was. And eventually they found out it was his hip labrum
Right.
and a
The
tear.
labrum helps hold the hip in place.
Yep. And if you tear your labrum, it can cause problems like it has been for him.
Right.
This technique can be good for arthritic hips.
Right.
So what you're going to do is go into your stairwell, pretend we have, put your foot in the first step. This is the hip that hurts that we need to put the decompression or traction on. You're going to hold on to the rail. If you don't have a rail, you're going to need something to hold on to so you can relax, maintain your balance. And the whole goal is, this is how I would explain to my buddy Tim. I said, just relax this leg. So just like it's completely relaxed, like it's jello, and you're just going to let it swing back and forth. And the weight of the hanging leg actually decompresses or pulls the joint apart just a little bit and takes all the pressure off of it. And you're moving it at the same time. And I said, if it gives you relief, it's going to happen right away. And it did, and he's been doing this. It takes the pain away
But
after
you
he gets
add
off.
weight pads or not?
Yeah, I'm getting to that. Yeah,
Oh,
Bob.
sorry.
Yeah, I'm taking the long
But I
route.
think you really got to make sure you're hanging on something stable.
Yeah.
When you're doing this.
Otherwise, you won't be able to relax.
Right.
If you
right,
don't relax
exactly.
it will not work unless you're
Yeah.
completely relaxed in the hip and then the whole leg.
Arms can be tight, but the hips got to be relaxed.
Right.
So
And then he says in his case, it feels good while he's doing it. And then afterwards, he walks around and it
Sure.
feels better.
you get some carryover.
Yep. So if you have a weight, this is the next step because it can be helpful. It's nice if you don't happen to have
That's a 5-pound weight.
no, I think this is 3.
3. Okay.
If you don't happen to have one of these, you can. I've had people if they have winter boots, just put the boot. They're usually a
Sure.
couple pounds,
Sure.
and then you don't have to buy anything, and it works fine. It doesn't.
Your kid hang on the
Well, your
leg?
hip, yeah, you can if you got a 2-year-old.
My kids used to do that. Like they grab onto my leg and they
yeah,
walk with them
yeah,
on.
that was kind of fun.
Yeah.
So here we do the same thing, and if you want to do it, you can try going this way, but it's hard this way because you're
Right.
pulling your hip back.
Yeah.
Typically, you're just going to go in this plane, flexion and extension, and I can feel the difference with this 3 pounds on there. I can feel that weight. It actually feels
It's-
good without a bad hip.
It's helping more.
Yeah.
It was
Mhm.
always,
So very good. That's the decompression. Do that, and you could, if that feels good and it's doing well, you can do that
yeah.
throughout the day a number of times.
And again, might give you some a couple hours of relief.
Exactly right.
So-
So very good. I hope this was helpful. You can keep those hips loose, flexed without getting on the floor. And once again, Bob, we can fix just about anything except for.
Broken heart,
There you go.
but we're working on it.
Absolutely right.
I
We
think-
should have a
you think
video on decompression of the heart.
we can't even figure out how to fix it now. We're gonna decompress it. So
Well, we don't worry about it. It all falls together. We'll get there. Good
it
night.
falls apart.